Hello everyone, my name is Namodi Sylvia, doing an artificial intelligence model that is diagnosing mental health issues. Sorry. My problem statement is to improve people's behaviors on how they feel and to be able to know how mental health has affected these people. Because mentally ill people are unproductive at work, and this leads to low productivity at work, which makes people they are working for make losses. The background of this model, of this artificial intelligence model, is to diagnose whether people are having mental health disorders. Mental health includes our emotional, psychological, and social well-being, and this affects how we think, feel, and how we act. Mentally, people with mental disorders are actually dangerous to our community because most of them commit suicide, which leaves trauma to the community. The significance of the model is to tell people whether they have any mental disorders or whether they are correct, they are okay. And if they have mental disorders, they are able to go to medical professionals so that they can be able to get help when it's still early, before it develops. The scope of this project consists of goals, deliverables, exclusions, tasks, and costs. The main goal is to be able to make a project that can make mental health diagnosis to people. Then the deliverables is to be, the model should be able to diagnose people correctly, whether they have mental health disorders or whether they are okay. Then the tasks is that the model has to be able to ask people questions so that it can obtain this data, and it will use it to make a conclusion whether you have mental health disorders or not. The exclusions are that this model won't be able to tell whether the person is asking questions is lying or not. Then the state of the problem being addressed is that there are a lot of people in our communities with mental health issues, and these people actually do not know that they have mental health issues. So they end up doing things that affect other people, and they don't know what to do exactly, and this has affected people's behaviors and their attitudes. The research question for this project include how can a person know whether they are mentally ill or not? Then the other one is mental health genetic? And if it is, how do genes affect a person's mental health? The hypothesis of this hypothesis is how a project can use its inputs to map to its output. So according to this project, the hypothesis is that the model will be trained using the data sets to learn how to make conclusions after getting the data it has received from its patients, so that it can be able to tell whether a person is mentally challenged or the person is okay. Then this artificial intelligence model, it's having two research objectives which it has to obtain, and these are to make the right diagnosis for people's mental health and also to give awareness to people about their mental health. The data set description of this model will include age, the age of the patient, the gender. It will ask whether you're an employee or not. It will ask about your family background, whether you've been having mental health issues. Then it will also ask whether you've been going for therapy, and many others. Then the methodologies this model is going to use include data collection, and this involves looking for data and gathering it together. This includes looking for the data sets to be used. Then there is also data pre-processing in order to remove noise from this data. Then there is model training. This includes teaching the model what it's going to do, and it should be able to do it correctly. Then there is model testing. This includes checking whether the whether the model is doing exactly how it was trained. Then there is model evaluation. This includes checking the level of accuracy of this model as it's working. Then those are the references I used for these slides. Thank you for listening to this recording.